When coming into my patient's room, I'm gonna do hand hygiene first. And while doing this, I'm gonna do a safety assessment. I'm checking my patient's airway, their breathing, their circulation. I wanna make sure they're not in any immediate distress. I'm looking at the emergency equipment on the wall, making sure I have an oxygen flow meter, a nasal cannula, and suction equipment. And I'm also gonna make sure that I provide privacy for my patient. Good morning, Alyssa.
Good morning.
My name is Alexis. I'm going to be your student nurse today. Is it okay if I do an assessment?
Yes.
Great. Before we get started, I'm going to look at your wristband. Can you tell me your first and last name and date of birth?
Alyssa DeSantis, November 28, 2001.
Good. And you know where you are this morning?
Sharp Grossman.
Good. And you know why you're here?
For my appendectomy.
All right. And you know the current month and year?
March 2026.
All right. I'm going to start with some vitals if that's okay.
Yep.
I'm going to get my patient's blood pressure, their temperature, their pulse, their respirations, and their oxygen saturation. All right, since you had that open appendectomy, I'm going to start with your stomach. I'm going to look at the incision if that's okay.
Yep.
All right, so you have a dressing. It's clean, dry, and intact. I don't see any distension beyond the dressing, no swelling or redness. What's your current pain level on a scale from 0 to 10?
Like a 5.
A 5. What's your tolerable level?
3.
A 3? Okay, so you're a little above that tolerable threshold. Is there anything that's making the pain better or worse?
Yeah, it's worse when I get up and walk around.
You're getting up and
it's
walking around.
better when I kind of just lay here.
Okay, and you have received some pain medications. Do you think those are working for you?
Yeah.
Okay, good. And then have you had a bowel movement yet?
Yes.
And what were the characteristics of that?
It was normal for me. It was solid.
Solid, nothing loose, watery?
No.
Okay, good. And then was there any pain with that?
No.
Alrighty. And then I'm gonna go ahead and take a listen. Bowel sounds are present, normal, active. Any nausea, vomiting?
No.
Appetite's good? Okay. I'm going to start with the rest of my assessment. I'm going to go up to your head, looking at your hair, your skin, behind the head for any pressure sores, behind the ears for pressure sores as well, especially if she had a nasal cannula on. Are you having any changes in your hearing, ringing in your ears, changes in your vision, taste, smell?
Nope.
Good. Okay. Any headaches?
No.
Changes in memory or speech? Okay. I'm gonna look in your ears. Turn towards me. Good. Open your mouth. Good. And in your nose. Alrighty. And then I'm looking at your neck for JVD, jugular vein distension, JVD or tracheal deviation. And then I'm gonna look at your eyes if that's okay. Can you look at me first? Your pupils are about a 4. They're equal and round. And I'm gonna use some light. So your direct constriction is good, as well as your accommodation. Direct constriction and accommodation. Good. And then your facial symmetry. Can you raise your eyebrows for me? Stick your tongue straight out. Puff up your cheeks. Okay, good. And then I'm assessing my patient's breathing. I want to make sure that their chest is rising and falling with symmetry, and there's no accessory muscle used. And I can also check the patient's skin turgor while I'm here. Are you having any shortness of breath? No. Okay. Any difficulty breathing? Any pain when breathing? Coughing? Okay. I'm going to take a listen to your lungs. When I place the stethoscope down, just give me a deep breath. I'm actually going to do my third check. Again, on the back side. And then okay, and I know that your abdomen's hurting. Are you able to sit up?
Yeah.
Okay, or will rolling over be easier? It's up to you.
I can sit up.
Okay, great. I'm gonna listen on the back. Deep breaths from me again.
Versus just start, go, stop.
Okay.
Start, go, stop. But I would test a giant file sending.
Okay. Lung sounds are all clear. While my patient's sitting up, I'm going to start at the occipital bone and move down and look at the scapula, the shoulders, down the back to the coccyx for any pressure sores, as well as just the general appearance of their skin. I'm going to look at their elbows. Can I peek at your elbow here and here? Good. No pressure sores. You can lay back down. Have you had any chest pain?
No.
Any palpitations, lightheaded or dizziness? No. Okay. I'm going to listen to your heart. When I get to that last point, I'm going to listen for a full minute.
Okay.
Yeah. So, let's say it's your patient and you're gonna say, hey, I see that you
Okay.
Okay, I'm going to listen here for a full minute.
or is it so it goes
I hear regular heart sounds, S1 and S2. And then, have you been able to urinate after surgery?
Mm-hmm.
Okay. And then how was that? Was there any pain?
No.
Okay. What was the color?
It was like pale yellow.
Pale yellow, good. And then it was clear?
Yeah.
Any odor that's abnormal for you? Was it urgent or frequent?
No urgency, no.
Okay, good. I'm gonna go ahead and palpate. And when was the last time?
Maybe an hour ago.
Okay.
Yeah.
It's not palpable, so that's good. I'm gonna come up to your arms. Can you feel my hands?
Yep.
Good. Skin is warm, dry, color is normal for her. Any pain? No. Numbness or tingling with this?
Mm-mm.
Okay, I don't see any swelling. I am gonna check the pulses on both sides to make sure they are present and equal. I'm gonna do cap refill. Should be under 3 seconds. Can you grip my fingers? I'm testing that strength is equal on both sides. Pull me towards you. Push me away. And then while I'm up here, I'm gonna assess her IV site. Any pain? Okay. I don't see any redness, swelling. It's not hot to the touch. And then same thing for the legs. Can you feel my hands?
Yes.
Good. Any numbness, tingling, pain? Okay. Skin is warm and dry, normal color. I'm gonna check her pulses. Make sure they're present and equal. I don't see any puffiness on the legs. I'm gonna take off her socks and I'll do cap refill. And I'm also gonna assess the heels for pressure ulcers. Okay. Are you able to bend your legs on your own? Yeah. Perfect. All right. You can straighten those out. I'm gonna look at your ankles. Bring your toes towards you. Good. And push them down. Same thing on the other side. Good. Okay. That is all for my assessment.
where do you wanna go? Let's go.
I'm gonna bring the head of the bed down.
Is that your last?
Do you have a good support system at home?
Mm-hmm.
Good. How's your hospitalization been so far?
Good. Ready to go home.
Good. Okay, I'm gonna make sure I give my patient their call light. The side rail's up, the bed is locked in the lowest position. I would remove my gloves and do hand hygiene and then make sure that I undo the privacy.